Hi everyone, my name is Zinzi Baleni and I'm the fourth year student under diagnostic ultrasound at the University of Johannesburg 2021, and this short video is going to be about the scanning protocol and technique of ocular ultrasound. So to start off, when you're doing an ocular ultrasound, you're going to use a high frequency transducer, mostly being a linear transducer like this one, which has a frequency between 5 and 12 megahertz. And if your machine does not have a presetting for ocular ultrasound, you can use the superficial preset for the examination. And then these are the two most important buttons on the computer that you're going to, on the machine that you're going to use throughout your scan. The TGC that you're going to be used to adjust the gain of the image. Depending on how your image is, you're going to adjust it according to the level of brightness or darkness you want your image to be. And then this is the focus, where you're going to be adjusting your focal point when you're looking at the globe or looking at the anterior aspect of the globe, as well as when you are assessing the posterior part of the globe, where you're going to be looking at the optic nerve. And then this is your freeze button. This is the overall gain. With overall gain, the entire image intensity is either increased or reduced, unlike the TGC, where you can choose at what level of along the beam axis you want your image to be darker or lighter. Okay, and then the other thing is that you can use, this is a tegaderm. If your hospital has it, you can use this. This is a clear film, like an adhesive film that you can put on the around the patient's eye. But then when you use this, you must make sure that there's no entrapment of air below the tegaderm, because that then will make it difficult for you to properly scan the patient. As you know, air is not our friend in ultrasound unless you're doing lung ultrasound. Okay, and so now we are going to start with the exam. So when you start the scan for ocular ultrasound, you're going to have the patient, you can either have the patient lying straight, or maybe with the bed raised up a little bit, maybe less than 45 degrees, depending on the most comfortable position for your patient. Especially in emergency cases, most of the time you will find that the patient is completely supine. And then it's very important to use a very generous amount of gel, and the idea is to have as little pressure applied to the eye, especially in patients that might have head trauma and you don't know what's going in underneath, as the patient might have a globe rupture. So you use a large number of gel. So you're going to start, you do the scan in both transverse and sagittal. You're first going to start in transverse. You can have your pinky resting on the nasal bridge of the patient. Just make sure not to cut off the patient's breathing. And your probe marker is going to be on the patient's right, like we usually do with other examinations. Then you put the probe on, and then you scan in, you angle up, and then you angle down to scan the entire globe of the eye in transverse position. And then when you go in transverse, you're going to start scanning from the nasal bridge, which is medially, and you move your probe like that. You're scanning to the temporal side of the brain, which is the lateral side of the patient. While you're scanning through this, you're making sure that there's no like free floating or low level internal echoes inside. You also check if there's no retrobulbar hematomas or anything like that, depending on what the patient's history is. Okay, for dynamic studies, you're going to do them also in both long section and transverse section, where you ask the patient to look left or look right. In transverse and in long section, you're going to ask the patient to look up and to look down. And then this helps you to assess if there's any free-floating debris or a lens, or maybe if there's vitreous detachment, you're able to see. You're able to see or distinguish vitreous detachment from a retinal detachment. The last thing you will now have to do is to measure the optic nerve, as well as to put color Doppler on the optic nerve to check for possible occlusion of the central retinal artery. Once you have the optic nerve in view, you are going to measure the diameter. And when you measure the diameter, you start at the optic disc to guide you on at what level you need to measure. So you have to measure 3 centimeters below the optic, below the optic disc. It's supposed to be 3 millimeters, which is round about at this level. So you measure from one end of the optic nerve to the other end at the level of the 3 millimeters. And then you are done.